Hi, dear Group 3. My name is Nadine Aranis. I'm a physical therapist from Clínica Alemana, Santiago, Chile. And for this Module 2 bonus assignment, I chose the article entitled Multicenter Randomized Controlled Trial of Inhaled Nitric Oxide for Pediatric Acute Respiratory Distress Syndrome, which was written by Ronald Bronicky and collaborators, and is published in the article of Pediatrics from 2015. As a summary, the aim of this article was to test the hypothesis that inhaled nitric oxide would lead to improved oxygenation and a decrease in duration of mechanical ventilation in pediatric patients with acute respiratory distress syndrome. The PCOD acronym is population is children with ARDS aged from 44 weeks post-conceptional to 16 years, which were enrolled from 9 centers of the United States. The intervention was inhaled nitric oxide. The comparator was placebo. And in this case, the primary outcome was the decrease in duration of mechanical ventilation, measured as ventilator-free days at 28 days after randomization. About the time, the enrollment took place from 2003 through 2005, but the article mentions that the enrollment time was very slow, and they had to finish the enrollment earlier because and analyze data currently in 2015 because they had issues with the acquisition of inhaled nitric oxide and with the clinic. The study design was a randomized placebo-controlled trial. And for the variables, I decided to show them as the dependent variable, which was ventilator-free days at 28 days after randomization. This is a continuous variable. And the independent variable was the type of treatment that the patients received, which could be inhaled nitric oxide or placebo. This is a categorical, dichotomous, or binary variable, since it may only assume two different values. About the statistical analysis, they first used the students' t-test to assess the differences in baseline oxygenation index values. They also assessed the change from the baseline in oxygenation index and the days alive and ventilator-free at 28 days. These are all continuous variables, and as they wanted to compare the difference between two interventions, in this case inhaled nitric oxide group versus placebo, I think it was appropriate to use the students' t-test. And probably they used the Ampere t-test, although it's not mentioned in the article. In table 2 here, we can see that the oxygenation index values are shown in mean and standard deviation, so probably they distributed normally. And we can see that the baseline oxygenation index was greater in the placebo group versus in the inhaled nitric oxide group, with 25.6 versus 22. There was a trend toward an improved oxygenation index in the inhaled nitric oxide group compared with the placebo one at 4 hours that became significant after 12 hours. This is not graphed in the article, but they mention it. In table 3, we can also see the results of the t-student test in the variables that were days alive and ventilator-free at 28 days, which was greater in the inhaled nitric oxide group with 14.7 versus 9.11 in the placebo group, with a p-value of 0.05. To analyze the survival and the rate of ECMO-free survival, they used the chi-square test. And as these are both categorical variables, I think it was appropriate too. They show these variables in proportions or absolute and relative frequencies. And after the chi-square test, they used they did a feature exact test to confirm that the conclusions reached by the chi-square test were okay to say, because they consider the low observed cell counts. And again, as these are both categorical variables, I think it's appropriate. Also because feature exact test provides more exact values, not just approximations as chi-square test does. As a discussion, I think that at first when I look at this article, I thought it was like a survival analysis. So I thought I would run into hazard ratios or similar. But as I was reading it, I saw that they don't use mortality as a primary outcome, maybe because of ethical issues. I'm not sure, but they still declare that patients remain on the study drug until death, free of ventilator support, or until day 28 after the initiation of therapy. So I still think it looks like a time to event analysis. So which would be really nice to discuss. To finish the analysis, I would like to talk about the sample size calculation, where they used a two-tailed alpha level of 0.05, which is 5%. They used a power of 80%, and to determine the effect size, they used the difference in the number of days alive and free of mechanical ventilation to day 28 as at least 3 days. However, the article doesn't elucidate the source from where they target this calculation. About the variance, they use the standard deviation of the mean numbers of days alive and the free of assisted breathing, which was 9.8 days. And the dropout rate was not specified in the article. So based on these assumptions, the article says that the minimum sample size calculated for the trial was approximately 169 eligible patients per arm, but they finally enrolled a total of 55 patients, where 29 received placebo and 26 received inhaled nitric oxide. So I think this represents a very big limitation in the sample size calculation because the sample was relatively small and they failed to achieve the predetermined one. So that's my assignment. I hope you enjoy it, and I'll be happy to discuss any further.